So good afternoon, everyone. As mentioned, my name is Sylvia Muskie. I am a child psychiatrist and I work here at the Harris Center. Many of you might know it as formerly known as MHMRA of Harris County. I've been with the agency for almost 21 years. I primarily have done administrative work overseeing mental health services in the outpatient setting and in the mental health services inside the Harris County Jail. In addition, I continue to see patients, mostly children. So I am honored to have this opportunity to discuss this very important topic. When I was asked by the Hope and Healing Center to present on COVID-19 and anxiety, I said, sure, without a second thought, thinking it would be easy to put together. Well, the opposite is true. As I began my review of the literature, I found a lot of information. There is endless amount of data and information out there. So to condense it, I confined my talk to information mostly from the CDC and the WHO mental health websites. I did include some information from psychiatric organizations and articles that would come across my desk. My focus was to pay attention to common themes and patterns of information that was coming out. Please understand that this is ever-evolving situation and some of the information is still early in its stages of research. So I will begin. So, are you feeling irritable, tense, tired, disbelief, shock, numb, loss of interest or appetite, headaches, fear, anxiety about the future, anger, sadness, depressed, feeling powerless, crying, sleeping problems, trouble concentration, difficulty making decisions? Well, you are not alone. In the Kaiser Foundation poll that was done early in the pandemic, it was reported that nearly half of adults, 53% in the United States, reported that their mental health was being negatively impacted due to worry and stress over the virus. This is significantly higher than what was reported in the March polling from the Kaiser poll, where 32% of adults were reporting worry and stress. So you will see worry and stress is something that I will be talking and mentioning. This word, it goes on and on and on throughout the whole entire presentation. So I wanted to spend a little bit of time about this. I wanted to review information about it just to sort of put everything into perspective and remind everyone, stress, there's the good, the bad, and the ugly about stress. We know that stress is a normal biological reaction that we usually helps us address potentially dangerous situations. It helped our hunter-gatherer ancestors to survive. It ignites our fight and flight and free system in the time of danger. It helps us meet deadlines, keep our wits in chaos, help us with accidents. So stress in some scenarios can be a good thing for survival when this stress occurs in short spurts. But what happens when stress continues? What happens when our brain never really goes back to a normal state and it stays in a constant chronic state of fight, freeze, and freeze response? Well, first, we call this toxic stress, and it can begin to take a toll on our physical and mental well-being. You will see people begin to experience things like digestive issues like nausea, vomiting, difficulty sleeping, sadness, irritability, and difficulty concentrating. Many of these symptoms that are being reported during the pandemic currently. So over time, the continued strain on your body and stress can contribute to serious health problems such as heart disease, hypertension, diabetes, including mental health and behavioral issues such as depression, anxiety, and substance use. And when we have leftover heightened levels of stress that accompanies experiences such as physical and emotional abuse, exposure to violence, danger, we usually call this trauma. So I'm just trying to, in one slide, put this conceptually. So although the COVID-19 crisis began as a physical health crisis, it has the seeds of a mental health crisis. So to bring down some of the stress, I just want to summarize it in this little quote that I like a lot. So stress is like spice. In the right proportion, it enhances the flavor of the dish. Too little produces a bland, dull meal, and too much may choke you. So you also might hear stress and the Goldilocks effect, and might hear people talking about stress, how it might be good or bad by saying it's not too hot, not too cold, but it can be just right. So that's my introduction to stress. So let's talk a little bit about the state of mental health prior to the pandemic. So in this slide from NAMI, it shows us that the state of mental health prior to the pandemic, where 1 in 5 adults were experiencing symptoms of mental illness. 1 in 25 adults experience serious mental illness, and we usually describe serious mental illness as schizophrenia, bipolar, and major depression. We also found that 17% of our youth was experiencing a mental health disorder. The most common mental health diagnoses are usually related to anxiety. So this is why I'll just address anxiety in this talk a little bit. So anxiety is an intense, excessive, and persistent worry and fear about everyday situations. Just like stress, it can be on a spectrum, where some of it can be normal and help us function in our day-to-day lives, but when it becomes intense and excessive and it consumes and interferes with our daily living, it probably is a good sign to see a mental health provider. I add this slide because this is a definition of an anxiety disorder. It comes from the DSM-5, which is a guide used by clinicians to diagnose mental health conditions. It's updated and every time there's research that emerges. But the DSM-5 criteria highlights that when excessive anxiety and worry occur more than 6 months, along with the inability to control, and it's accompanied by three of the following physical or cognitive symptoms, such as edginess, tiredness, problems concentrating, irritability, it probably is beginning to meet a criteria of a disorder and probably would warrant further evaluation from a mental health professional. So in March of 2020, the World Health Organization officially declared the COVID-19 had become a pandemic. It hit at least 216 countries and in all the continents all around the world. Basically, COVID-19 created havoc around the world. It affected so many people and it overwhelmed our healthcare infrastructure. It created a very unsafe and unstable environment. We found people finding themselves in a perpetual sense of uncertainty. The virus also revealed and magnified structural inequities that led to disproportionate impacts of the virus among racial and ethnic minority groups. It really affected a lot of the social determinants of health, such as employment, income, housing, food security, which threatened our basic survival. It had a huge potential of creating, and I apologize, this didn't get timed as quickly as I wanted to, but it had the potential to create a perfect storm, and the word will come up in a minute. These are just headlines of articles that would come across my desk when the pandemic started that I wanted to share. And again, here it is, creating a perfect storm. So when I was asked to put together this talk, I ran across this quote from Dr. Twing from the Washington Post, and I think she summarized everything very nicely. She said, in some ways, this is a perfect storm for mental health issues. We're dealing with social isolation, anxiety around health, economic problems, and all of these situations are linked to mental health challenges, and all of these are hitting many of us all at once. So Dr. Twing referenced a lot of non-medical factors that we are calling social determinants of health. So what are they? So the CDC describes many social determinants of health as the conditions in which we are born, grow, live, work, worship, and age in. These dimensions affect our health, functioning, and quality of life. They help shape the conditions of our lives. So to help understand the impact of the pandemic, I wanted to focus it through this framework of the social determinants of health. Here's a slide of the wellness wheel, and it sort of helps look at all the dimensions of what we can see of the social determinants of health. There are various wellness wheels out there. I picked this one from Clarion. Again, it talks about the spiritual aspect of our lives, the intellectual, physical, emotional, financial, social, and occupational. But for purposes of this talk, I'm only going to focus on 3 of the dimensions of how the pandemic has affected us and how it affects our mental health being. So financial. So we know financial wellness is very important. It helps us live financially, and planning for future, having financial stability is a very important aspect of having good mental health. But what we found during the pandemic was it caused financial distress, and it disrupted daily living more quickly than any economic downturn. The extent and the severity of these continued hardships like hunger, evictions, and homelessness are at an all-time high. The fallout has been widespread, and it's been prevalent among the Black, Latino, and Indigenous immigrant households. We know from research that job loss is associated with an increase of depression, anxiety, substance use, and suicide. Social. So we know that having a good and strong social network is very, very important. This usually helps us with when we're dealing with stress. Having a good social network, being able to reach out to relationships is very, very crucially and important. But what happens when we are told to socially isolate for our physical protection? Well, we know that the brain's a social organ. It requires stimulation and connection to survive and thrive. We know Dr. Perry, a child psychiatrist who specializes in childhood trauma, talks about the brain without connection to other brains, and without adequate interaction will shrink and eventually die. Dr. Murthy, a US surgeon back in 2014, also brought to our attention the experience of loneliness, and this is a concern of a public health concern. He pointed out the association with the reduced lifespan and greater risk of both mental and physical illness. So when the response to the crisis was to close non-essential businesses, schools, and mandatory stay-at-home orders for prolonged time, it has definitely taken a toll on the mental and physical health of many. We see the effects of these social isolations have taken a toll on our recovery population. We're seeing that 13% are reporting substances to cope with the pandemic stressors. In a recent RAND survey, it was recently reported that alcohol consumption had increased about 14% compared to 2020. Compared to the previous year of 2020. As we know, most meetings have gone to a virtual platform, which is probably something that will remain an option once person-to-person meetings resume. But we know from many that they miss the connection of seeing people in a person-to-person meeting. So I cannot go on to talk about the pandemic without taking a little bit of time about how social media and its effects, both positively and negatively. This in itself can be another discussion, but I wanted to highlight some ongoing themes and concerns. So we know social media has made the world more open and helped connect to millions and millions of voices during this time of period of social isolation and quarantine for safe purposes. It's been really an effective tool in helping people stay employed, connect to their healthcare providers. Psychiatry, I can tell you, has definitely made a huge change. I don't see us going to business as usual, having people come to the office, but having more of the virtual platform. It definitely helps students of all ages to continue their schoolwork. But it also did create some challenges for those students that didn't have the resources to be able to connect virtually to school. But technology's promise has kept us connected and has given us a rise of some unintended consequences that I wanted to highlight that is beginning to catch up with us. We know approximately 10 years when Facebook and Google started coming online, we began to see a lot of anxiety, depression, and suicide rates. Now that most of our lives are virtual, we are spending a lot of time in front of the screen. We are spending less time with our communities and even within our own household with our family members. And we're beginning to see many patients. I have personally began to see a lot of patients come into my office who are reporting a lot of increased screen time. They're reporting poor school performance, sleep disturbance. Some are becoming addicted to video games. Others are becoming targets of online predators. These are things of concern with regards to what might be occurring with the pandemic. If you haven't seen the documentary on Netflix yet of Social Dilemma, I highly recommend it. It emphasizes the importance of managing screen time and monitoring what your kids and maybe yourself are looking at and how this might affect your mental and physical health. So we know for a fact that health disparities have been experienced by racial and ethnic minority populations pre-pandemic. We know that COVID-19 revealed structural inequities that led to a disproportionate impact of the virus among the Black and Hispanic groups. Focusing on these disparities are going to be very crucial in helping communities respond to the virus effectively. We need to begin to grow mentally and physically healthy communities. We also need to speak about systemic racism and the abuse of power. We know that the Latino and community has experienced this almost on a daily basis. We also know that witnessing acts of racism produce emotional distress, and that it can also lead to poor health and contribute to anxiety and depressive disorders. So emotional. So we know maintaining a healthy life is important to maintaining an emotional life. It's important that we learn how to manage our stress by staying on top of things at work, at school, exercising, diet, but we're beginning to see how the pandemic is affecting this. Let me talk a little bit about pandemic fatigue. So in a recent article in the New York Times, it was reported that physician burnout had long been a serious concern in the medical community, with roughly about 400 doctors were dying by suicide each year in the United States. The pandemic has only exacerbated this trend. The results of recent polls from October 2020 reported that out of 862 emergency psychiatrists nationwide, 87% felt more stressed since the onset of the pandemic, and that 72% experienced a greater degree of professional burnout. I can personally share that among my colleagues and myself, many physicians and nurses and therapists and pharmacists here at our work, you will hear them talk about sitting and listening to the hardships that our patients are going through, the losses that they're dealing with, and at times that they themselves as a professional are feeling powerless to help. On top, so many of us are even dealing with our own hardships as we're listening to other people's hardships. So many are dealing with spouses losing their jobs, and of course homeschooling kids while you're trying to work at home. Of course, it's not only the healthcare pandemic, but it's all of us. We are in this for almost a year now, and even with the vaccination giving us glimmers of hope, we all know that this is still a marathon to the finish, that many of us are still trying to keep our head above water. So the crisis hotline, here's some data that they have been reported from the COVID-19 and how this might have some long-term impact on the mental health. They're beginning to cite some increases in domestic violence calls and opioid overdoses. There are crisis hotline calls into the crisis hotlines are beginning to rise. There was a report that I found that the Los Angeles suicide and mental health hotlines have increased their calls by 8,000%. So let me put this a little bit into perspective. So Los Angeles happens to be a hub for national disaster distress lines. So some of these calls could have been during, could be attributed during the wildfires. But I can tell you locally, I started looking at some of the data of our own crisis hotlines, and they were reporting not so much that we were having an increase in calls, but they were noticing these kind of data, that 28% of the callers were having symptoms of suicide or concerns of suicidal ideation. That 30% of the callers were also ultimately needing to be referred to an outpatient mental health professional to see them. 25% of the calls were requiring an immediate urgent care or referral to the nearest emergency room. And that 15% of the calls that were coming in were coming from the National Suicide Prevention Hotline. So what I want to emphasize on that data point was sometimes we'll get the overflow that might come from the National Suicide Hotline, so that we were getting the 15% of those calls that were going to that 1-800 number and being funneled over to us. We also have some COVID-related data that is important to emphasize. So modeling has suggested that the pandemic will lead to about 75,000 deaths from alcohol and drug misuse and also suicide. As mentioned earlier, the CDC was reporting an 18% increase of death from drug overdose compared to the previous year. So here we have a graph. It was a survey that was done looking at the frequency of anxiety and depression symptoms. It was conducted by the US Census Bureau. This graph shows sort of the results from May 2020 to October of 2020. So basically a 6-month time period. And so what we see is that anxiety symptoms began to increase nationwide from the start of the pandemic, and they began to peak in the month of July, with 30% reporting feeling anxious or on the edge more than half of the days in the week. But then we see that these symptoms decrease, with the exception of hopelessness. This we saw increase steadily, and it reached a high of 37%. I want to highlight this piece in particular. This graph really spoke to me and really brought a couple of things that I wanted to emphasize. So we know that there is no single cause for suicide, and that there are a lot of risk factors and warning signs that may increase the likelihood of a suicide attempt. Hopelessness is a dangerous suicide warning. Even when we see other symptoms such as the anxiety and the depression symptoms go down or not be apparent, it is important that when someone is speaking and talking of hopelessness, not worth living, even if they seem to be functioning in their day-to-day lives, it is something that needs to be referred to a professional. This is very concerning. You will hear stories over and over of people saying he seemed to be doing well, she seemed to be doing well. In fact, this morning I heard on NPR a story that Las Vegas County was seeing an increase in rise in deaths of ER visits secondary to suicide, specifically in teens. And there was, of course, a mom that was talking about her teenage son who had just graduated from high school, who was feeling a little bit down about not being able to go to college, but decided to take a break from going to college because he didn't want the virtual experience and going to work. She reports that he seemed to be doing well, and then all of a sudden he committed suicide out of the clear blue. So I think it's very important, though, research is, so although we don't have numbers, nationwide numbers about the suicide deaths of 2020 yet, and research is clearly not showing the link between the suicide and the pandemic, but there is areas of growing concern. And I can't do enough. It could be a complete other talk of the importance of paying attention when people are feeling hopeless. So this slide is sort of just trying to put the magnitude of the impact of COVID in one slide. It's not possible. There's a lot of stuff that I missed out. But one of the things that I wanted to emphasize was the piece of how many people are dying on a day-to-day basis. They're reporting over 400,000 deaths due to COVID. But the thing to emphasize and to highlight is the importance of how millions and millions of people are dealing with grief. And they're dealing with this grief in a socially isolated venue, which sometimes is, well, not sometimes, it's usually not the healthiest way. We are very used to going with family members and trying to deal with grief as a together, but the social isolation and the quarantine has created this to be difficult. I didn't put up the contacting the virus because, of course, this number changes continuously. We've mentioned about healthcare workers and the burnout and the mental health stress for our frontline staff, not just healthcare workers, but people who have to go and work on a day-to-day basis. The mass unemployment that we are dealing with, we have tens of millions of individuals that are unemployed. Our homelessness is increasing. The homeschool, some kids having lack of online resources to be able to continue even some sort of education. And then of course, the biggest issue is the social isolation and being quarantined is giving a big magnitude to our mental health. I can't go on without talking about the magnitude and the impact for minors. We really don't know what the impact for kids are going to be, but we know that children are particularly vulnerable to mental health effects of the pandemic, most of it resulting from the school closures and the suspensions of social activities, and also witnessing the stress that maybe some of their parents are experiencing, either due to job loss or just losses of family members from COVID or any other issues that might be dealing. The isolation that we know to save lives is really affecting our kids significantly in their developmental core. So the bottom line, we are going to hear a lot of stories from every person, every child, every family members about the COVID-19. Research is really limited and many of these findings are considered early, but research is going to be pointing out to probably an increase in symptoms of depression, anxiety, and maybe even some trauma triggers during this pandemic. So I can't go on also talking, not mentioning the natural disasters that many people have had to deal with during this pandemic. As many of you know, hurricane season was probably our busiest storm our busiest storm system that was recorded ever. We had individuals in California dealing with the wildfires, and we also know that currently our Northeast area is dealing with winter storms. So this is sort of just an additional layer of stress and anxiety that people are dealing with, even as we're dealing with the pandemic within itself. So I want to end this talk a little bit of talking of some stress management techniques. Let me start off with this cartoon because I think this is probably a lot of people can identify the way we we manage stress. So we have two gentlemen here at dinner talking, and one saying, I learned about stress management from my kids. Every night after work, I drink as much chocolate milk as my stomach will hold, eat handfuls of sugary cereal straight from the box, and run around the house in my underwear, squealing like a monkey. I know that is something I've definitely have done. But I wanted to point out some recommendations from the National Institute of Health and the CDC. Some of these recommendations, I'm sure many of you have seen and heard over and over, but it does warrant reviewing. So it's important to be observant and recognize the signs and symptoms of your body's response to stress. It's important to take breaks from the news and social media. If you're beginning to see any healthcare issues, please contact a healthcare provider. It's important for your body to get some good sleep, diet, exercise. They recommend at least 30 minutes a day if possible, finding activities to help you unwind and engage, the ability to connect and talk to others. It's important on setting priorities and goals, not staying alone if possible. Again, we're in a quarantine pandemic, but these are some of just the basic recommendations and just a reminder of what we can do to help ourselves during these stressful times. For those of you that like to listen to podcasts, I do recommend the Happiness Lab. It sort of recommends the latest research on happiness and sharing some practical ways of reminding us to be social, reminding us to be grateful, aiming to be present in the moment, reminding us to get rest and stay active, and reminding us to practice kindness. So cultivating mindfulness, as many of you know, this used to be sort of seen as a new age kind of technique, but it's being recommended more and more each day by medical professionals. We know mindfulness, it's defined as the awareness that emerges through paying attention on purpose, being present in the moment, being non-judgmental, and unfolding to the experience moment by moment. It's shown to be very effective to reduce stress and relieve symptoms of anxiety and depression. It is something very helpful. Some people find it difficult to sit still and have their minds just sort of focus and not go off and trying to get control. So here I have a technique called the butterfly technique. So if mindfulness is difficult, maybe giving this a try is effective. This was a method that was created by an EMDR therapist who worked with kids in the aftermath of the earthquakes in Mexico City back in 1988. It's been a great tool for calming and grounding whenever you're feeling anxious and stressed. It's called the butterfly hug. And so basically what you do is you cross your hands across your chest. Well, actually you put your fingers, your hands together, palms facing yourself, fingers connected together. I don't really raise my elbows to create the butterfly wing. I just kind of keep it closer to my chest, but you lay them across your chest and you slowly tap yourself left and right. And while you're doing this, you breathe in through your nose and exhale through your nose until you start to begin to feel some relief. I found this very helpful sometimes when it's hard to sit still and get your mind under control. The simple tapping across your chest can be very helpful. Highly recommend it. So I did want to add a slide for if you should be needing to assist somebody who's having anxiety or depression or some sort of mental health crisis. Here's a mnemonic that I took from the mental health first aid course. It's a 5-step action plan and it's worth just reviewing. They use the mnemonic called ALGAE, and it stands for A, assessing the individual whether they are at risk for suicide or harm is the first thing to do. Second is the L, to listen to that person non-judgmentally. G, give them reassurance and information. E, encourage that they seek appropriate professional help. And also E, encourage self-help, such as some of the techniques that we went through, and maybe giving them other supportive strategies. So I want to end the talk on some resources that I found during my research. So Los Angeles Department of Mental Health had this slide of apps that are available that not only address some of the emotional well-being, but some physical well-being, some intellectual well-being, and some also financial well-being to help people as a resource. We here at the Harris Center utilize these wellness apps, the Ask app, the MY3 app, and the Hope Box app that we have found very helpful for our patients that come to seek help with us. This is the contact information for the Harris Center. It's the 713-970-7000 number. And also the Hope and Healing has also started their own Hope line, which is the Houston Hope line. It's the 832-831-7337 number. There are other resources out there on the national level. APA has the coronavirus resources. They have a disaster distress hotline, the National Suicide Prevention Hotline. We have some physician support lines, crisis text lines, and some veteran crisis hotlines. So I want to thank everyone for giving me the opportunity. I tried to give a very broad overview of the pandemic and some of the mental health issues rising. I will be open for questions or thoughts or concerns should anyone have any. Thank you.